I guess we are live. You can unmute yourself, Ashutosh.
Okay, all right. So shall we start?
Yeah, we will wait for some
Great.
few
Good evening.
participants to join. Good evening. We will wait for a few minutes and then we can start our discussion. We can't see any
Okay.
participants count here. Yeah, that would be available on Facebook Live.
So, hi guys. Welcome to today's session of Blue Circle Diabetes Foundation Type 2. Welcome to all of you. Thank you for tuning in and taking time out on a lovely Sunday evening. So,
Guys, are we
Vikram and
audible?
I are going to be co-hosting a session.
Yeah. Yeah, you're audible, Ashutosh.
So, today, Vikram and I are going to be hosting a session on type 2 diabetes, and we'll be covering the various myths surrounding this metabolic disorder. A brief about both myself and Vikram. My name is Ashutosh Marbali. I have been associated with the Blue Circle Diabetes Foundation since the last 3 years now. I joined the group in 2020. I have been type 2 diabetic since last about 10 years. Uh, my diabetes is currently well controlled with oral medication and lifestyle changes. Vikram, you would like to?
That's Hi guys, I'm Vikram Pataskar. I'm from Pune and I have been associated with the Blue Circle Diabetes Foundation from last 3 years. I have joined that group in the March 2020 and since then I am attending all the uh, sessions and runs and our meetups. Currently, I'm managing my diabetes with oral hypoglycemic medicines and few times insulin injections. So it's working on combined therapy, and yeah, that's pretty well.
So great. That was a brief introduction of both of us co-hosts for this session. So we start off with what type 2 diabetes is. So diabetes is mainly a metabolic disorder caused due to deficiency of insulin or due to insulin resistance. So broadly, there are three types of diabetes, which are Type 1 diabetes caused due to in the insulin deficiency, where the pancreas are not able to produce insulin in the body, and the person has to take manual insulin shots to compensate for the lack of insulin produced by the body. Then type 2 diabetes, which is caused mainly due to insulin resistance, where the body is not able to utilize the insulin properly, and there are high blood glucose in the body, glucose levels in the body, and there is gestational diabetes caused during pregnancy in women. There are also type 1.5 and LADA. I am not very knowledgeable about those, but yes. So broadly, these are the types of diabetes mellitus which are there. And today we will be covering type 2 diabetes, which is caused mainly due to insulin resistance. So broadly, it is type 2 diabetes is characterized by excess blood sugar, insulin resistance, and a relative lack of insulin. So mainly
I guess Ashutosh, you are not properly audible.
am I audible? Am I visible?
Yeah, you're not visible right now, but you're audible.
Some issue with my camera. Bear with me, please.
That's fine. Yeah.
Yeah. So insulin resistance and insulin relative insulin deficiency characterize characterize type 2 diabetes. So insulin is a hormone that regulates blood sugar in the body, and pancreas are not able to produce enough insulin to regulate blood sugars effectively. This can from disease or a loss, which are more common in type 1 diabetes. I will speak in Hindi as well for the convenience of the audience members who are not very well versed with English. So इंसुलिन रेजिस्टेंस तब सेल्स जो हैं वो इंसुलिन को ठीक तरह से रिस्पॉन्ड नहीं करते हैं, प्रोड्यूस करता है बॉडी बट उसे ठीक तरह से रिस्पॉन्ड नहीं करते हैं। उस वजह से जो पैनक्रियाज है वो इंसुलिन प्रोड्यूस करते जाते हैं ताकि ब्लड शुगर्स कम हो, बट इवेंचुअली दे आर नॉट एबल टू कीप अप, और ब्लड शुगर बढ़ता है। जो इंसुलिन रेजिस्टेंस है
Uh, Ashutosh, you are not properly audible again. So I will continue for some time. Uh, is that okay for you?
Please. Yes, yes, please,
Yeah.
please.
Yeah. सो हम हमें सबको ज़्यादा टाइप 1 और टाइप 2 डायबिटीज़ के बारे में पता है, बट आज के वर्कशॉप में हम उसके बारे में थोड़ा डिटेल्ड इंफॉर्मेशन कलेक्ट कर रहे हैं। सो टाइप अब हमारे सबके डायबिटीज़ में इंसुलिन एक मेन फैक्टर है। इंसुलिन इज इम्पॉर्टेंट टू कीप योर ब्लड शुगर्स इन चेक। जब भी हम कुछ खाना खाते हैं तो उसके बाद इंसुलिन रिलीज होता है पैनक्रियास के बीटा सेल्स की वजह से, और वो शुगर लेवल मेंटेन करता है बॉडी में। और जो शुगर है वो प्रॉपरली ब्लड के थ्रू बॉडी सेल्स को एनर्जी प्रोवाइड करता है। तो डायबिटीज में क्या होता है, एक तो आपका डायबिटीज अभी बहुत सारे टाइप के डायबिटीज हैं। टाइप 1 और टाइप 2 आर मेजरली नोन टू ऑल द पीपल। टाइप 1 डायबिटीज में ये होता है कि आपके बॉडी में, आपके पैनक्रियास में बीटा सेल्स डीजनरेट होते हैं, प्रॉपरली काम नहीं करते, इसलिए वो इंसुलिन क्रिएट नहीं कर पाते। सो इट इज कॉल्ड इंसुलिन इनसफिशिएंसी। जिसके वजह से क्या होगा कि जब भी आप खाना खाओगे, आपके ब्लड में शुगर रिलीज होगा, बट वो प्रॉपरली चैनलाइज होके सेल्स के यहाँ पे पहुंचेगा नहीं, तो एनर्जी स्टोर नहीं होगा, ब्लड में फ्लो होता रहेगा। और टाइप 2 में क्या होता है कि हमारा पैनक्रियास इंसुलिन क्रिएट करता रहता है, बट वो प्रॉपरली उस इंसुलिन की सेंसिटिविटी कम हुई रहती है, तो फिर भी वो काम ठीक से नहीं कर पाता है। जो 1 यूनिट इंसुलिन काम पहले करता था ब्लड शुगर नीचे लाने के लिए, वो अभी उसके लिए बॉडी को 2 यूनिट बनाना पड़ता है। तो ओवर द पीरियड ऑफ टाइम ये इंसुलिन का जो प्रोडक्शन है थ्रू पैनक्रियास से, वो बढ़ता जाता है, बट हमारे ब्लड शुगर लेवल्स मैनेज नहीं हो पाते। तो दिस इज कॉल्ड इंसुलिन रेजिस्टेंस। और फिर आफ्टर सर्टन पीरियड our body pancreas stop creating insulin, so we might need insulin therapy at that time. Over to you, Ashutosh. Ashutosh. सो हमने अभी इंसुलिन इनसफिशिएंसी और इंसुलिन
आज
रेजिस्टेंस के बारे में जाना। अभी सिम्टम्स के बारे में बात करें आशुतोष। हेलो।
okay, yeah. So symptoms typically of type 2 diabetes get आपको थकान, ऑल द टाइम थकान बढ़ी हुई रहती है, यू आर कॉन्स्टेंटली हंग्री और आपको यू फील लाइक ईटिंग। कोई अगर चोट लगी होती है, कोई भी वुंड, उसको हील होने में नॉर्मल से ज़्यादा टाइम लग जाता है। दीज आर ब्रॉडली द सिम्टम्स विच is Vikram, would you like to elaborate?
Actually, I'm not properly able to hear you. I just re-entered to the stream. Yeah, yeah, voice is breaking. So symptoms में I don't find it pretty अलग ऐसे कुछ सिम्टम्स नहीं दिखे जो टाइप 1 में होता है। मोस्टली वही सिम्टम्स मुझे दिखे। मतलब जब मुझे डायग्नोसिस हुआ था, तो मुझे बहुत प्यास लगती थी, भूख बहुत लगती थी, कुछ ध्यान नहीं रहता था, हमेशा थका हुआ रहता था, और वही फ्रीक्वेंट यूरिन पास करना पड़ता था, और इरिटेशंस होती थी स्किन्स में। और हाँ, एक सबसे बड़ी बात, जब भी हमें डायबिटीज डायग्नोसिस होता है तब हमारा मसल लॉस होने लगता है, हमारा वेट सडनली ड्रॉप हो जाता है। सो जब मुझे मेरा डायग्नोसिस हुआ था तब मैं 85 केजीज से 70 केजीज तक आ गया था। व्हाट अबाउट यू आशुतोष?
अ, मुझे जब या so the first time that I was diagnosed, me to he asked me to do an HbA1c test and also my fasting and PP blood sugar test, because of which
Okay.
then the diagnosis was quite clear. My A1c was pretty high at that time. It was around
May I
9,
ask
and
how?
my fasting and PP both were 200 plus. I cannot remember the exact figures right now.
Okay.
So both were very high, and I was initially put on glycomet by my family physician. And yes, I was able to control the sugar with the lifestyle modifications, with the diet, exercise. But yes, it is a if, type 2 diabetes progressive disease wherein if you do not pay proper attention to your nutrition, medication, lifestyle, it does progress. So I did take the consultation of uh, endocrinologists. So
Okay.
this is my now ninth year with this disorder. I won't call it a disease. It is a type two is a disorder, disease disorder, metabolic disorder due to the
Okay.
hormones, due to insulin hormone.
मेरी स्टोरी थोड़ी अलग है। आई वॉज इन माई फर्स्ट ईयर्स, मेरा एग्ज़ाम्स चल रहे थे तब, और मुझे नॉर्मल सा बुखार आया था, बहुत सर्दी भी हुई थी, बट वो बहुत मतलब वीक फील हो रहा था, इरिटेशंस हो रहा था। तो जब एग्ज़ाम्स के टाइम पे मुझे बुखार आया था तो डॉक्टर के पास जाने के बाद उन्होंने मुझे रैंडम ब्लड शुगर चेक करने के लिए बोला, विच केम टू आई गेस 500 प्लस। फिर उन्होंने मुझे नेक्स्ट डे ग्लूकोज टॉलरेंस टेस्ट करने के लिए बोला। उस टाइम पे मेरा उसका रिजल्ट कुछ तो 650 आया था, which was pretty high. And then I was admitted to the hospital, and doctor performed HbA1c, and it was around 13.5 at that time in 2013. So I was diagnosed with type 1 at that time. So मैं तभी नोवो नॉर्डिस का मिक्स स्टार्ट 3070 इंसुलिन लिया था। एक साल तक मैंने इंसुलिन पे ही था। तभी मैंने कभी मतलब मेटफॉर्मिन लिया ही नहीं था तभी। बट उसके बाद भी इंसुलिन थेरेपी के बाद भी मेरे शुगर्स नॉर्मल रेंज पे आ ही नहीं रहे थे। सो एट दैट टाइम डॉक्टर प्रिस्क्राइब मी सी पेप्टाइड टेस्ट। सी पेप्टाइड टेस्ट का रिजल्ट बहुत हाई आया था। सी पेप्टाइड टेस्ट ये बताता है कि आपके बॉडी में कितना इंसुलिन क्रिएट होता है। अगर कोई हेल्दी पर्सन है, डेफिनेटली टाइप 1 डायबिटीज पेशेंट के अंदर इंसुलिन सफिशिएंसी का प्रॉब्लम रहता है, तो उसका रिजल्ट बहुत ही लो आता है। मतलब इट वाज अराउंड 0.5 0.35. In my case it was 6.5. सो ये तो क्लियर था कि मुझे इंसुलिन इनसफिशिएंसी का प्रॉब्लम नहीं है उस टाइम पर. इट इज नॉट टाइप 1 डायबिटीज. सो आई वाज मिसडायग्नोस्ड विद टाइप 1 डायबिटीज एट दैट टाइम. एंड धीरे धीरे फिर इंसुलिन का डोज कम करने करते 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 मैं मेटफॉर्मिन पे शिफ्ट हुआ. और अभी भी मैं मेटफॉर्मिन के साथ बाकी कुछ भी ड्रग्स लेता हूँ. और इंसुलिन भी कभी कभी चलता है. नेक्स्ट मंथ मेरे 10th डाइवर्सरी है.
Since we also due to continuous आपका ब्लड शुगर कंटिन्यूसली एलिवेटेड होने के कारण जो इश्यूज हो सकते हैं दैट कैन अफेक्ट योर हार्ट, योर किडनी एंड योर आईसाइट एंड योर सेंट्रल नर्वस सिस्टम. तो आप ज़्यादा ये चार ऑर्गन्स जो है मेन आपके ज़्यादा वल्नरेबल हो जाते हैं. सो यस, मैनेजमेंट ऑफ टाइप 2 डायबिटीज़ इज़ वेरी क्रिटिकल. I hope I'm audible now. Is it better?
Yeah, 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 yeah. It's better now. Guys, do you have any questions for us? Please put your questions in comment box. We will try to answer your questions.
We would like this not just that we should keep talking. We would like to hear from you. आपके जो भी सवाल हैं कोई आप इस चैट में we will reply to that. Great. I think then we can move on to the next
नहीं, एक,
segment. We have pretty much covered what type 2 diabetes exactly is.
there is one question that Amez wants to know that what are various techniques to reduce insulin resistance in your body? Would you like to answer this, Ashutosh?
What are the various techniques to
Reduce insulin resistance.
so the easiest, rather the most simplest and most effective would be to reduce the carbohydrate intake, added sugars, and carbohydrate intake of your body to improve, become more active physically. Start small. I'm not start lifting weights gradually, but well as a small walk, then graduate to brisk walk, jogging. These are, I think, some things which will improve the insulin sensitivity. Any Vikram, how about you?
Yeah, you covered pretty
What would you
well.
like to say to this question?
Just I would like to add that what happens is if we keep eating मतलब जब भी हम खाना खाते हैं तब इंसुलिन स्पाइक होता है. So if we can reduce the amount of spiking insulin in our body, we can increase our insulin sensitivity. देयर इज वन मोर क्वेश्चन, जिनको टाइप 2 है वो कभी भी टाइप 1 पे जा
Vikram, there
सकते
is
हैं
a
क्या?
question for you. Has your
Yeah. So what happened when I was
has your weight?
diagnosed? My weight was dropped to 70 from 85, and after taking insulin, it has started again increase in the weight. So right now my weight is stabilized around 80 to 85 kgs again. अनीता ठाकुर का एक क्वेश्चन है, जिनको टाइप 2 है वो कभी भी टाइप 1 पे आ सकते हैं क्या?
Next segment.
जिनको टाइप 2 है वो कभी भी
I
टाइप
guess
1 पे
gradually,
आ
if
सकते
not
हैं.
if it is not controlled, I think eventually.
Yeah. So if you don't check your blood sugars in range over a period of time, your sugars, uh, uh, your body will create more insulin to keep your blood sugars at low level, and one fine day it will start to collapse and it will not create the insulin. So so it is very important to manage your diabetes very well from the first day itself. और ऐसा भी हो सकता है बाद में कि आपको कॉम्बिनेशन थेरेपी लेना पड़ेगा. एक तो इंसुलिन रेजिस्टेंस भी है, तो इंसुलिन सेंसिटिविटी बढ़ाने के लिए भी दवाई लेनी पड़ेगी और इंसुलिन भी लेना पड़ेगा. I hope Anita Thakur I have answered your question well. Do let me know if you still have question. This is very important question. Can type 2 diabetes be reversed? Ashutosh? Ashutosh, unmute yourself.
I could not hear you. Could you please repeat your question?
Can type 2 diabetes be reversed?
Type 2 diabetes be reversed? I think yes, it can be reversed, but I think also depends case to case. Also depends on how much advanced the diabetes has gone, how high the blood sugar levels are. I think a doctor would be able to comment better on that.
हम उसे रिवर्सल फिर भी नहीं कहेंगे. इट कैन बी कॉल्ड एज रेमिशन, क्योंकि लाइफस्टाइल चेंजेस के बाद जब भी आप
Yeah,
कहते हो कि आपका डायबिटीज रिवर्स हो गया, उसका मतलब क्या है कि आप अपना मेडिसिन बंद कर सकते हो और फिर भी आपका ब्लड शुगर लेवल मैनेज हो रहा है, दैट योर इंसुलिन इज गेटिंग प्रॉपरली यूटिलाइज्ड, राइट? सो अगर आप जो अभी एफर्ट्स ले रहे हो वो
correct.
मैनेज करने के लिए, अगर वो बंद कर दिया, तो इट कैन कम अगेन. Then you would be need to take medicines, insulin again, right?
करेक्ट. इफ यू गो बैक, एक बार आपका आपके शुगर्स अगर आ गए कंट्रोल में, और आपने अगर दोबारा जो पुरानी जो आपकी आदतें थी, यू गो बैक टू योर ओल्ड फूड हैबिट्स, and you don't exercise as much, you don't take care, you consume alcohol, you smoke, you party late nights, sleep late. If you go back to the same old lifestyle, I think it is possible that you come back to square one.
Yeah.
So while it is reversible, I won't say it's totally मतलब curable. Curable तो नहीं है, but remission, yes. There are some cases also that I have seen. I'm part of those cases. So minimum, medication which is given to someone who's at a
Okay.
I think I hope that answers your question, Krishnan.
Yeah. Shall we move ahead, Ashutosh?
Yeah, yeah, please.
Shall we start busting some myths?
Yeah. So I think
Tell
the
me if
most common,
we have covered all the basic questions, right?
correct.
Ashu, Ashutosh, uh,
I guess
type,
I think we
huh,
missed out on one, the diagnostic.
diagnostic test. Okay. So, डायग्नोसिस के लिए आपको फास्टिंग ब्लड शुगर और पोस्ट प्रांडल ब्लड शुगर चेक करने के लिए कहेंगे जिस और एच बी ए वन सी करने के लिए बोलेंगे अगर आपका एच बी वन सी 5.7 से 6.4 तक है तो आप प्री डायबिटिक कहलाओ जाओगे 6.4 से आगे जब है तो आप डायबिटिक हो तो nowadays डॉक्टर सी पेप्टाइड भी प्रिस्क्राइब करते हैं टू अंडरस्टैंड वेदर यू आर टाइप 1 और टाइप 2 उसके अलावा अगर आपको डायबिटीज़ है तो ईयरली चेकअप हमेशा करवाना चाहिए उसमें आपके किडनी फंक्शंस लेवल चेक किए जाएंगे थायराइड फंक्शंस चेक किए जाएंगे लिवर फंक्शन टेस्ट आई आई चेकअप होता है जिसमें रेटिना चेक किया जाता है ऑप्थेल्मोलॉजिस्ट द्वारा और फिर ईसीजी होता है डायबिटिक फुट टेस्ट भी होता है बहुत सारे अनकंट्रोल्ड डायबिटिक पेशेंट्स में डायबिटिक न्यूरोपैथी का इशू होता है जिसमें आपके सेंसेशंस इन फीट कम हो जाते हैं और इंजरी होने के बाद भी हमें पता नहीं चलता इसलिए ईयरली चेकअप के चेकअप में अपना फीट चेकअप भी करवाएं
Any for
Your voice is breaking, Ashutosh. अनीता ठाकुर हाँ
kidney function tests also.
या अनीता ठाकुर इज आस्किंग दैट टाइप 2 एंड टाइप 1 की डाइट सेम होनी चाहिए क्या Are you able to hear me, Ashutosh?
Yeah, I can hear you. I'm just thinking. I think the type one. I'm not very sure. I guess broad. Halanki, I think type one wale. I understand have to be a lot more strict. You know, the body does not produce insulin, and they have to manually take insulin shots.
Insulin.
थोड़ा बहुत अगर थोड़ा सा कभी इंडिसिप्लिन हुआ कुछ हुआ you can get away with it because the body produces insulin,
Yeah.
but I think yeah,
But
type 1
overall
does not mean that type
objective
2 should be,
हमारा
you know.
ओवरऑल ऑब्जेक्टिव यही है कि हमारे ब्लड शुगर लेवल्स रेंज में रहने चाहिए. तो इट वुड बी बेनिफिशियल दैट इफ यू स्विच टू low carb diet,
बराबर
reta- yeah, reduce your carbohydrate intake, know what you're eating, and that would be said to you. We have already done the carb counting
correct. I
sessions
think
previously.
for
You can refer to that.
yes, for both type 2 and type 1, I think is one to correct your diet. आप जितने भी कार्बोहाइड्रेट सोर्सेज हैं आपके डाइट में कम से कम रखें और focus more on protein and fat.
Yeah,
Correcting the insulin, carbs have the सबसे ज़्यादा spike होता है, followed by protein, which has a medium to a moderate spike, and fats have absolutely minimal spike. There are some who also follow the same discussion हो जाता है, so I don't think we'll be able to do justice to that, but ketogenic is to put it in short, you use the body saturated fats, which compensates for the lack of carbohydrates. So your body, once the reserve of the body depends primarily on the glucose as a source of energy. So once the source of glucose is depleted, the body then starts dipping into fats as a source of energy.
yeah,
Anyway, that is that topic deserves a separate session altogether. We will not get into
discussion.
that
Yeah,
right now. So yeah, I
yeah.
hope that yes, I hope that has answered ma'am's question.
In type 2, one of the most dangerous happening is hypo low sugar.
Wishes
Any your
once
comment?
has
So, so Ashutosh, did you faced any hypos in this journey? In my case, I haven't faced मतलब बहुत कम बार हाइपोग्लाइसेमिया होता है क्योंकि आई एम नॉट ऑन इंसुलिन सो वो मैनेज हो पाता है बट
I
या
have
कभी 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 भी
I have
हो सकता है हाइपो तो यू नीड टू
never
कैरी
had
योर
this.
हाइपो किट.
आई हैव बीन वेरी लकी. ये मेरे लास्ट 9 साल में मुझे सीवियर हाइपो हुआ था और फॉर्चुनेटली मैं उस टाइम पे घर पर था, तो able to control the situation. For whatever otherwise, I think I have never faced. But yes, it is be careful always when you have diabetes, type 1 or type 2. I think always better to carry a hypo kit along with you with some glucose biscuits or some candies or mints to to provide you instant
Blood sugar spike, yeah. What is your favorite hypo cheat?
Sorry, can you repeat? I could not hear you.
जब आपको लगता है कि आप हाइपो में जाने वाले हो तो आपको क्या खाना पसंद है?
आई थिंक इजीएस्ट सबसे आसान तो पार्ले जी बिस्किट्स हैं। एक तो मतलब आसानी से मिल जाए, एब्सोल्युटली प्योर एकदम आ जाती है तो यार दैट हैज द फास्टेस्ट रिजल्ट आल्सो इन केस
हम्म, जब मैं घर पे होता हूँ
ऑफ
तो मुझे
हाइपोग्लाइसीमिया।
जब मैं घर पे होता हूँ तो मैं एक चम्मच
है कि
जैम खा लेता
कभी
हूँ।
वैसे सिचुएशन हो नहीं।
हम्म, अदरवाइज मैं अपने पास ग्लूकोविटा के टैब्स रखता हूँ तो which helps me to manage my hypos. Okay.
Great.
Uh,
Shall we move on to the next myth?
yeah, sure. क्या
Diabetes can be reversed by home remedies like वो नानी माँ वाले नुस्खे जो होते हैं, जामुन जामुन के पत्ते, करेला की
जामुन सीड्स? आपने ट्राई किया है कभी ये सब नुस्खे? जामुन के सीड्स, करेला, करेला जूस या फिर पनीर फूल?
have I have tried पनीर फूल थोड़ा टाइम किया है, का किया है, फिर नीम का वो है। मे बी नीम was a bit effective, but I was told to stop by my doctor, couple of them actually, because they said that it has a negative on your sperm count. I am not very sure कितना accurate है, but ठीक है, अब डॉक्टर ने बोला है तो I did that suggestion seriously. एंड उसके बाद फ्रैंकली वाइल देयर वाज अ मोमेंटरी रिलीफ, बहुत ऐसा खास फर्क तो नहीं पड़ा था ब्लड शुगर पे, जितना इम्पैक्ट लो कार्ब का हुआ है। आई डोंट थिंक एनी अदर लाइफस्टाइल चेंज हैज मेड दैट बिगर डिफरेंस इन मैनेजिंग ब्लड शुगर्स।
मेरे हिसाब से ये सारे नुस्खे ओवरऑल वेलबींग के लिए अच्छा इफेक्ट करते हैं, बट इट इज नॉट wholeheartedly treatment for treating diabetes. Sure, it will have positive effect on your body, but it will not help in managing your diabetes altogether. ये जो टाइप 2 डायबिटीज है सिर्फ अडल्ट लोगों में होता है या बच्चों में भी होता है?
सॉरी मैंने सुना नहीं, क्या बोला?
Type 2 diabetes only affects older adults, or it can be diagnosed in younger patients also?
These days, like I mentioned earlier, I'm part of that low carb wala community, so There have been cases. So one of the ladies there is a low carb nutritionist. So uh, she mentioned that she had a case of a 13-year-old child who had come for consultation because he was diagnosed with type 2 diabetes purely due to sedentary lifestyle, playing of video games instead of going out and playing sports. Does not help that अभी ये सारा मैकडोनल्ड्स और पिज़्ज़ा हट all these fast food which are readily available, Maggie noodles and so on. Another case was told to me by one of my doctor friends was that uh, the patient had come was a 16-year-old like slightly matlab, child, I would still call it a child only below 18 though a slightly older child. uh, तो क्या हुआ था that his mother saw उसका जो वॉशरूम था वहाँ पे वो कमोड के यहाँ पे there were a lot of ants that were coming in and just to rule out they took him to the doctor and the results were shocking. तो उसका भी वो आया A1C वगैरह काफ़ी हाई आया था. It was more than 6. So yes, the incidence of younger children developing type 2 diabetes is also on the rise.
Yeah. So it is a vice versa also applicable that younger patients can also be diagnosed with type 2 diabetes and older patients can also be diagnosed with type 1 diabetes. So there is no any hard and fast rule for that.
See, while I would like to say that family history plays a role, family and genetics play a role in type 2 diabetes, I think it is also your own habits, your own lifestyle that will, to a great extent, influence whether you will develop type 2 diabetes.
Yeah.
So yeah, the good news is that type 2 diabetes can be controlled, can be managed, and you can lead pretty much normal lifestyle, regular. You can lead your regular lifestyle without too many disruptions.
And
In the last decade,
even
to
if you have any family history of having diabetes, you can, and if you are not yet diagnosed with diabetes, you can still delay your getting diagnosed with diabetes by your healthy choices, healthy lifestyles, healthy food. Yeah.
correct, correct. I agree.
ये type 2 डायबिटीज सिर्फ ओवर
Ameya
वेट
has
या
a
ओबीस
question. What is your take on?
हर्बल में.
Sorry, I interrupted you. You were saying something.
Yeah, yeah. First, we will answer the questions of Ameya Panchita. What is your take on herbal medicines for long-term management of type 2?
What is your take on herbal medicines for long term of type 2? I would say tread with caution. Consult your doctor, whatever it is you're planning to do. Because
Don't.
even at the outset, when I was at the pre diabetic stage, that time I did consult Ayurveda, and while there was some short term relief, I did not really uh, find any great benefit in that. I feel it is best to consult your doctor on this.
And it is always advisable that even if you are going with these herbal medicines for long-term management, don't stop blindly taking the oral medicines or whatever the medicines prescribed by your doctor. Have discussion with your doctor and then do what you want to do. It is also said that type 2 diabetes should not check their blood sugars very frequently like type 1. What's your take on this, Ashutosh?
Can you repeat that, please?
It is always said by the older people and some doctors too that type 2 patients should not check or they can avoid some blood sugar checking, like they can do less checking from like type 1. That type 1 diabetes patients check their blood sugars at least 6 times a day, but we don't need to check that much time in type 2. Is that correct?
I guess it depends on the individual. You don't need to, yeah, you don't need to, like type 1, you don't need to keep checking it. I think once in a week, maybe Saturday to Saturday or Sunday to Sunday is good enough, unless you're getting typical hypo or hyperglycemic symptoms. I think you are, as long as you're maintaining your lifestyle, taking your medication, I think in my experience, once a week should be okay. And your
My take would be, yeah, it can be monitored very less as compared to type 1, but try to check your sugars at a different times. Like, don't just don't check on fasting and pp at the breakfast time. You may try to check sometimes with this lunch and dinner, so you know that how food is affecting your blood sugars. It will give you the not like graph, but you can try to analyze your food and uh, manage your food as well. But yeah, it is not that we don't need to check that frequently as compared to type 1.
Of course, if you can spare the money, there are CGM monitors which many of our type 1 friends were using. You could just if you wish to, if you are a little concerned about if you're typically seeing hyper or hypoglycemic symptoms, impact of different foods on your blood sugar also, maybe that will also you with regards to, if you have it on continuously, how also your sleep impacts and your other aspects of your lifestyle. So you could even consider taking the aid of a CGM machine.
Yeah. Does type 2 diabetes have only
We have
affect small
another
number of? Yeah. How to regain your muscle in type 2 taking 2 tablets a day? The answer would be pretty simple. Have a prescribed amount of protein and do strength training. क्योंकि अगर आप
correct, I
प्रोटीन
second that.
प्रोटीन कंज्यूम नहीं
For
करोगे तो आपका मसल बढ़ने वाला नहीं है. तो you have to take your protein intake very well, and it is to be combined with strength training. You have to lift the weights in gym. That would be the best option to regain your muscles. And it is not applicable for type 2 or type 1, it is for everyone.
correct, I agree.
Ashutosh, do you want to tell anything else?
We can go on to the next. Yes, I think you have pretty much covered it. Weight training is a very not only building muscle but also improving, from my perspective, in maintaining
Okay. Do you guys have any other questions apart from this? Please put your questions on the comment box. Otherwise, we will. It is almost been an hour.
I think we can move on, Vikram.
Yeah. Shall we end this?
So one of the myths is that you just keep taking medication and बस गाड़ी चलती रहेगी. Is that approach the right approach for managing of type 2
O-
diabetes?
Obviously not. Medicines are not miracles. You have to combinely have to put your effort into that. After certain period of time, medicines won't work if you don't help yourself. तो बस मेडिसिन खाने से कुछ नहीं होगा. You have to push yourself. तभी तभी जाके ब्लड शुगर्स मैनेज होगा और ओवरऑल वेलबींग अचीव होगा. Diabetes is a progressive disease or disorder, as you say. We have to take care of us each day, every minute. We are the only advocates of ourselves.
If I have to, may I say? So
Yeah,
what I would like to add is that depending only on the medication, to lower the blood sugar, and then you're eating what you want, not exercising, sleeping whenever you want, not following a good lifestyle. I think that's a lot. If I have to compare, I have to give an analogy. It would be like when you get your credit card, you're paying the bare minimum, and then you're carrying it forward, but then you end up paying a much higher rate of interest on the bill.
yeah, sure.
Were you able to hear me?
So we have tried to uh, answer your questions. If you guys have any other questions, you can just ask it on the
Hello.
Facebook community, Diabetes Support Network India, or if you are added to the WhatsApp group. Please do let us know about your concerns.
About you're only having medication and not and
Okay. Please follow us on social media platforms like Facebook. We have a community over there called Diabetes Support Network India. Please follow us on Twitter, Instagram. We try to manage and give you guys a new types of sessions every Sunday. We also organize chai meetups, runs once in every month in the popular cities like Delhi, Mumbai, Chennai, Kolkata, Pune, Jaipur, Ahmedabad. Try to attend that. Let's increase our community span. And thank you, Blue Circle Diabetes Foundation, that gives us opportunity to host a session like this. We look forward to attend and to also co-host more sessions like this.